Good morning. It turns out when you use your hands to articulate that the podium shakes, so I'm going to have to focus on keeping mine down. For 11 years, the National Assembly on School-Based Healthcare, otherwise known as NASBC, has been working to realize a vision that all children and adolescents are healthy and achieving at their fullest potential. We're one of the dots that Anne referred to earlier. I am excited to have this opportunity to publicly endorse the Community Agenda for America's Public Schools on behalf of NASBC, school-based health centers, and their sponsors. NASBC knows the importance of local partnerships between schools and community organizations. In the school, these partnerships are especially strong with the pupil personnel such as the school nurse, the school counselor, the school social worker, and school psychologist. Indeed, the partnership is the cornerstone of the community agenda and the foundation of our own work. Nearly all school-based health centers are operated as a collaboration between schools and health organizations such as community health centers and hospitals. School-based health centers bring the doctor's office to school so that students can avoid health-related absences and get the support to succeed in the classroom. In today's education environment, school-based health centers have demonstrated their value to schools and communities. By addressing students' health and mental health concerns, the clinics have contributed to positive academic outcomes as evidenced by increased seat time, decreased absences, and decreased school discipline referrals. They support the school in a myriad of ways by providing students with required immunizations, providing preventive medical services and mental health services, by treating acute illnesses and managing the care of students with chronic conditions such as asthma and diabetes. School-based health centers also help families by providing referrals for social services and supports, and they provide faculty with training and consultation that makes it easier for them to do their job, teaching students. These issues and others are real. Everyone knows that they affect students' ability to learn. They are excuses for not having high expectations for our students. Rather, are they excuses for not having high expectations for our students and having quality teachers in the classroom? Of course not. But we know that every parent who struggles with a chronically sick child or whose child has an acute health problem needs the kind of support for their children that health institutions and schools can provide together. And we know that every child should have access to quality health care, and why not in a place that is most convenient for them and for their families, and in a way that supports their education. School-based health centers have been successful because access is immediate and the health center staff becomes identified as a normative part of the school. School services include students as responsible participants in their health care, encourage the role of family members, and are confidential and culturally and developmentally appropriate. As a result, health care for students improves and emergency room visits can decline. For an example, in New York City, emergency room visits for asthma were more than halved in students with school-based health centers as compared to those without. As a nurse practitioner in a school-based health center for more than 15 years, I highly value all the partners in a community school. Everyone has a role to play to help young people grow up healthy and achieve academically. We believe at NASBC that the community agenda will launch a deeper dialogue about the link between health and education and about how the entire community can work together for student success. We know how to work together with schools in that way, and support does not distract from student learning. NASBC looks forward to working together with all of the community agenda participants and endorsers to get outcomes that we all desire for young people. Thank you.